Good afternoon and welcome to today's webinar titled Moving, Marriage, and More, What TRICARE QLEs Mean for You. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized services such as military exchanges and morale, welfare, and recreation sites, the Defense Department does not exercise any editorial control over the information you may find on these locations. Such links are provided consistent with the stated purpose of this Defense Department-sponsored webinar. When it comes to your TRICARE coverage, certain life changes are known as qualifying life events, or QLEs. When you and your family have a QLE, you have 90 days to make eligible changes to your TRICARE health plan. This webinar will discuss the types of changes that count as QLEs and what to do after you have a QLE. You'll also learn tips for navigating certain QLEs. We're thrilled to have with us today Robert Whalen, Beneficiary Counseling and Assistance Coordinator, TRICARE Health Plan, Defense Health Agency, and Sarah Kern-Wilson, Health System Specialist, Customer Support Branch, TRICARE Health Plan, Defense Health Agency. Without further ado, I'll turn things over to Sarah.
Good morning, everyone, and thank you, Tina. Good afternoon as well. I'm Sarah Kern-Wilson. I work for Defense Health Agency for the TRICARE Health Plan, Benefits Counseling and Assistant Coordinator, as well as Party Correspondence Action Officer. My other colleagues that were with us here today are Mr. Bob Whalen, Ms. Brianna Flowers, and Mr. Calvin Keller. Our topic for today, TRICARE qualifying life events. Today we will talk about the types of QLEs, what you do after experiencing a QLE. We'll talk about some examples of the QLEs, how to change your plan without a QLE. We'll also go over dental and vision coverage, and we'll look at some resources. All right, what is a TRICARE qualifying life event? That's where you have a change in your life where you can select other TRICARE plan options that are available for you. That could be a change in the family, a change in the sponsor's military status, or a government-directed change. With QLEs, there's a 90-day window for a TRICARE QLE that's outside of the TRICARE open season timeframe. When one family member experiences a qualifying life event, all family members at that time can change their enrollment if they choose to. Just remember, though, there's one change per member per QLE. All right, some types of QLEs. Let's look at those. First, there's moving. Moving from the U.S. to overseas is a QLE. Also, moving from one region to another. That would be moving from the West region, which is Health Net Federal Services, to the East region, which is Humana. Or it could be just simply moving from one city to another in the same state. There's also changes in the family. Could be marriage, divorce, and annulment, of course, giving birth, or adopting a child. Also, a court-ordered placement of a child in your home. And the date of that QLE starts the date on the court order. And it must be court-ordered in order to qualify as a QLE. Even when your children become adults and they're heading off to college. However, you have to change the address in Deers in order for it to qualify as a QLE for those children that are headed off to college, or a death in the family. There's also a change in the sponsor status when the sponsor is retiring from active duty, also separating from active duty. And for our Guard and Reserve personnel, activating or deactivating, and also a QLE medical treatment. There's also gaining and losing command sponsorship, and this is for overseas only. Deployment doesn't necessarily qualify as a QLE in itself. However, when the sponsor deploys and if the family relocates to a new country or a city or region, then that change of address would trigger the QLE. Okay, losing sponsor or family member eligibility. For our Guard and Reserve members, turning 60 years old and going to the retired reserve, you can enroll in TRICARE Select or Prime when eligibility is reflected in DEERS. And that's the key point. It has to be reflected in DEERS, and the member is drawing retired pay. TRS at that time, which is TRICARE Reserve Select, TRS ends when you transfer to the retired reserve. Also, QLE is gaining or losing other health insurance. That would be an employee-sponsored health insurance. Also, Medicare and Medicaid entitlements. That's for those that are 65 or older, and also for those under 65 with a certain disability. If you qualify for those, then your TRICARE fees are waived. If there's a change of availability, in a single family member in another family. So say you have both parents are sponsors. So a change in the eligibility status of either of those members of a joint service family. And then there's a government directed. That's where the government has directed you to change your PCM either to a network, from network to a military hospital or clinic, or vice versa. And the other one for government directed would be that the government no longer offers a certain TRICARE health plan in your area. So that would qualify as a QLE as well. And we can find more information on those at tricare.mil/life events. So what do you have to do in order to affect the QLE, to actually change it and it reflects in your DEERS record? The first thing you have to do is contact DMDC, that's Defense Manpower Data Center. They manage the DEERS database. So you would contact them first. Take a look at your plan options, and you can look at that on tricare.mil. Also, make eligible enrollment changes within the 90 days. That's the key when it comes to QLEs. There's a 90-day window within the 90-day window. And then also, you have to contact your TRICARE regional contractor. Again, that's Health Net Federal Services for the West region, and it's Humana for the East region. Okay, so again, in most cases, you have to contact DEERS because it's a two-step process. Contact DEERS first, make any changes. If it's OHI that you have to report, if you have to, update your address, of course, update a phone number, update, the birth, have to contact DEERS first. Only sponsors, can make updates into the DEERS records. And you're going to need the official documents to affect those changes. For a marriage, it's the marriage certificate. Of course, with the birth of a child, it's a birth certificate. And so on and so forth. A person, attending college, you're going to have to get, the college information for that child and semester hours, all of those things in order to present it to the DEERS office. And here are some ways that you can update your DEERS. In person, at a Rapids ID card office. And you can find any office in your area by going to the DMDC website. Also, MilConnect. You can make those changes in MilConnect. You can also call by phone. A fax is also provided. And then also mail it into the DMD support office. You can find more information for these offices at tricare.mil/DEERS. And now I will turn it over to my colleague, Bob Whalen.
Well, thank you very much, Sarah, for all of that. Again, my name is Bob Whalen. I'm with the Defense Health Agency as well with TRICARE Health Plans. And I work primarily in the enrollment issues department. So this is very near and dear to my heart. We're going to talk about now what Sarah had mentioned about what to do when you have a QLE. We're going to talk about where you go from there and some examples. First of all, after you do what Sarah said about updating DEERS, your change has thereby been recorded and reported by DEERS. That's what their job is. They report the changes, they report eligibility. Then, depending on the QLE or whatever situation you may have, some QLEs count for different things, some don't. You have a couple different options. First of all, if it's just a move, you're in TRICARE Select and you're just going from city to city in your same region, and you're happy with what you have, no need to make a change. Or Prime, you have to change your primary care manager, but you don't have to change plans at all. If you like what you have, no reason to change. Second, if you do want to make change, you could change your plan. But again, you have 90 days from that QLE to do it. Now, when you want to enroll in a plan, you have to do that as well in 90 days. So we have two pieces here. You have the changes, so you want to change plan, or somebody who's newly enrolled. Both of those, 90 days. And what I wanted to reiterate, down at the bottom here, DEERS handles all the eligibility issues. Actually, eligibility comes from the service. Service reports to DEERS, and DEERS puts it out there and reports it, and it records your dependents or yourself as eligible. If there's an issue with that eligibility, then you need to go to DEERS. How to make somebody eligible for healthcare, that's all DEERS. They report that, and DEERS and TRICARE talk back and forth. There's a constant, anytime changes are made in DEERS, it gets reported up to TRICARE immediately. Now, if you're eligible, and then you have enrollment questions, then certainly call your regional contractor. Okay, so if you want to change your plan, number one, you definitely want to explore your different options. So certain plans are based on many things. Number one, your beneficiary category, whether you're a sponsor, a spouse, a child, incapacitated child, parent, in-law, whatsoever, or you could have location, prime versus select. There are some areas, prime is locality based. It is based on what we call a prime service area. If you're not in a prime service area, which and otherwise means you're within a certain range of a military treatment facility, then you have to have select. That's your only option. Then age, of course, is a big factor. As we know, TRICARE covered children age out at 21, or if you're a college student, age out at 23. Those are issues. And then again, when you turn Medicare eligible, that's another age factor. And then status, of course, active versus retired. Those are different things that can affect the changes that you make. So when you've decided, okay, I want to make that change and I do qualify for either prime, select, whatever, number one, you want to figure out how exactly is that going to affect you? What kind of consumer are you? What do you need? Do you want someone who wants a primary care manager to manage everything for you? Or are you somebody, perhaps, maybe you have a chronic disease and you have a specific specialist that you see all the time. You don't want to keep getting referrals to that one specialist. Well, then select is probably your best bet. So what you can do, TRICARE.mil has a treasure trove of information. If you've never been on that website, I highly, highly recommend it. TRICARE.mil. First, you want to go to the plan finder to see what plans you are eligible for, and that's TRICARE.mil/plan finder, very simple. Then you can compare. They have a great comparative tool on there that puts one next to the other, shows you all the different nuances of each plan, and that's on TRICARE.mil/compare plans. And then you want to compare costs. That's a big one. One can cost you more on one side, but then more on the other. You just got to figure out, take a look at what you've got going on, what kind of healthcare consumer you are, compare costs, see what's best for you, and that can be on TRICARE.mil/compare costs. And then find a doctor. We also have both on TRICARE.mil, they have a provider directory. Actually going to link you to whatever region you belong to, and it's going to link you to their provider directory. And that's on TRICARE.mil/find doctor. Okay, enrolling or changing enrolling. Number one, the process for enrolling is very simple. There are two different ways you can do it. There is an online version on the Beneficiary web enrollment site, which is on right off MilConnect. It's part of the MDC. Or you can do the simple thing, very simple, call the contractor. They will give you all the information you could possibly need. Now, the coverage will start on the date that QLE occurred. For example, if a child was born on such a date, no matter when you called in to enroll them, after you've gone to DEERS, of course, when you call TRICARE to enroll them, it goes back to their date of birth. So no matter what happens, it always goes back to the date of QLE. And then once you make a change with that QLE, it's locked in. Then you can't use that QLE, okay, well, it's still within the 90 days and we changed our mind. Want to go back and do this or do that, the other thing. Or if you enrolled your child in one plan and then you want to enroll them in another, well, change your mind. Look it over. Like I said, do your research, know what you're going into, make that change. When you have that QLE open, make it worthwhile. And then Once you're enrolled, that coverage will continue until open season. If you want to make a change, you can. If you don't, it just let it roll and let it ride. It keeps going. And so you have another QLE or open season, same thing. Now, one thing I do want to say is that when you have a change, if you're retired, if you're going into the retired section, any kind of retirement plan requires enrollment fees. Now, you'll notice the note on there, in order to enroll, you must pay all applicable enrollment fees. It's an annual fee, but you can break it up into monthly, quarterly, or one lump sum annual payment. But if you do monthly, they're going to want a couple of months up front before you enroll. And if you are already paying enrollment fees and you're single and you're adding a dependent, well, then that's going to switch you from single to family, and vice versa. If you have a family member who leaves or whatever for any reason, well, drops off the plan, you go back to single, well, then your plan will drop costs. Then you go back to single. But I want to reiterate that you have to make the payment, and payment is always due. If you have friends, you have relatives, look around, this payment is always due. Regardless if you say, though, TRICARE never told me it was due, it's due every single year. And if you do monthly, it's due every month, just like a house payment, car payment, whatnot, it's always due. If you pay quarterly, well, then circle your calendar, it's due, because there are issues sometimes. TRICARE notifications either get sent to junk mail in your email, or they get lost in the mail somehow, they get tossed, whatever. Just know, it's just like a house payment, car payment, it is always due. What do I do if I don't act within 90 days of the QLE? Well, for a simple thing, if you're just moving and not changing your plan, that's no big deal. I mean, so you don't change it, you don't change it. But if there's an issue such as a child or marriage or any situation like that, or another good example is if you are in a prime service area and you move out of a prime service area, you need to do a drive time waiver if you still want to keep prime. But if you're outside that distance and or you don't sign the drive time waiver, TRICARE will drop you, unfortunately, and you will go into what's called direct care only. And you will only be able to get care at a military treatment facility if they have room. It's space available. And you go, it's not a benefit, it's not an entitlement. You don't get care automatically because you're either retired service member or family member. You go to the bottom of the barrel. They'll only see if you have that room. And if you have a child or a spouse who don't get around to enrolling them within 90 days, again, they will go into direct care only until you have another QLE or it comes around to open season. So 90 days. Now, if you get married and you don't have that paperwork done, you need to get it done within 90 days. Okay, now what we're going to do is we're going to go into some examples. I know I went off a little bit on them in the last portion, but we're going to get a little more down and dirty on it. And the first one we're going to cover is moving. Now, if you're moving, whether it's across the country, overseas, to the next town, no matter what, don't call and disenroll from TRICARE. Just do what you got to do, get settled in, contact DEERS, put in your new address, and then it's recorded. Now, if you're changing regions, well, then you'll need to call in the new contractor and say, hey, I'm here, I'm new, and they'll go through. If you're in if you're prime, they'll help you transfer your PCM. If you're select, well, then you just switch over to select. But you definitely want to update your address in DEERS. Like I said, you have 90 days. It's pretty simple. And then again, like I said, you have TRICARE.mil. If you get to a new location, you want to find a new doctor, we have a website ready to help you out. TRICARE.mil/moving. Okay, marriage. As it says, not only are spouses eligible, but stepchildren are eligible as well. One thing you do have to watch out for is if those children are already covered because your new spouse was formerly married to a service member and those children are also covered under that service member, you have to make sure that they're put under the right one. You can't be under both. So you have 90 days from the date of marriage, regardless. 90 days. Trust me, I hear this all the time. We didn't have the documents. We didn't have this. We didn't have that. What I would do if I were you, go on, it says on the right-hand side, it says documents you need before you can enroll a spouse. I would suggest, usually there's a long what they call in the military flash to bang time you get engaged, time you get married. You've got time. You've got all kinds of time to get these documents together, because I see it all the time. They don't get it taken care of within the 90 days because they got married, they went on an engagement, honeymoon, whatever, come back, might be day 60, they go to Deers and they say, where's your birth certificate? They go, and then they have to go get it. And sometimes it takes time if they have to request it from the state, and then they go over the 90 days. If you care about your spouse or future spouse and you want them enrolled by the time you get married, get the documents in order. Otherwise, I can bet you what your next QLE will be if you don't care about it. So plain and simple, 90 days from the date of the QLE, make sure you have your documents in order 2 years before you go. Again, any questions, TRICARE.mil/marriage. Gives you everything you need to know there. Same thing with children. You have 90 days from the time you adopt a child or the date of birth. 90 days. Now, there has been some issues in the past where sometimes now Deers will say, sometimes Deers will accept a hospital birth certificate. Sometimes they want only the live birth from the state. Call your Deers representative, your nearest one, find out what they will accept, work on it really hard, make sure you get these documents together within those 90 days. You have 90 days if you're stateside and 120 days if you're overseas. 120 days because you have to report it through the embassy. The embassy has to do the certification of child born abroad, all that stuff. There's State Department forms, and eventually get a little certificate that says report a foreign birth abroad, and that counts as your birth certificate. And sometimes it takes time. So they give you that extra 30 days. One thing I want to stress here, and over here in the notes, says once registered in Deers, active duty family members only will auto-enroll into Prime, and only if you live in a Prime service area. Now, if you're active duty and you bring your new dependents in to register in Deers, they will auto-enroll in Prime automatically. If you wanted them to be in Select, you have to actually call TRICARE and get them switched to Select. It's just the opposite if you are not a Prime service area and what you're called TPR, and it's TRICARE Prime Remote. If you're in TRICARE Prime Remote, your dependents, your new dependents, even if you call the contractor and get them all rolled into TRICARE Prime for family members, when you have a new child or a new marriage, that dependent will auto-enroll into Select because you don't live in a Prime service area. Want to make that clear, that you understand that. And then also, retirees will never auto-enroll. If you're a retiree and you're adding a new dependent, they will never auto-enroll, regardless of what they tell you. Oh, Deers said I was good to go. Good to go meaning you're registered in Deers. That's it. You are not enrolled in TRICARE until you contact TRICARE yourself and enroll. Want to make sure I make that very, very clear. This is a great platform to put that out. Tell your friends, tell whoever you know that that's one of the biggest problems we face all the time, is that they didn't know that they were auto-enrolled in Select, or they thought they were going to be auto-enrolled and they weren't because they're retired. And so it becomes a big issue. So again, if you have any questions about it, TRICARE.mil, and there's TRICARE.mil/children. Tell you everything you need to know about adopting a child or having kids. All right, retirement. Retirement is different because active duty and reserve, whenever you retire, instead of the 90 days, you do get 12 months. When you retire from active duty, you will have 12 months from your retirement date to enroll yourself and your family members. And make sure you mention the family members too, because sometimes people get caught up and they say, I just want to enroll, and they only enroll themselves. That is an issue as well. However, one of the reasons why we changed it from 90 days to 12 months is because the services have historically been slow in processing the paperwork and giving it down to Deers. We were seeing it taking 6 to 8 months sometimes. So we just stretch it out to make it 12 months. So now you have 12 months. The caveat to that is that your QLE begins on the date of your retirement. So you're finally getting your paperwork down through Deers and it's October. and you retired in January, you will have to back pay all the TRICARE enrollment fees all the way back to January. The only other way around that is to just wait until open season and re-enroll for the new year if you're closer to January than you are to, whatever. But you will have to pay the total enrollment fees up until that date. Now, for Reserve National Guard retirees, this is another one that we need to put out and make sure everybody understands, because again, it becomes a very big issue. If you're a gray area retiree and you are authorized to draw retired pay earlier than age 60, great, you're drawing retired pay. You still are not, absolutely are not entitled to TRICARE Prime or Select, the regular retiree TRICARE, until age 60. It's a flat out age 60, regardless of when you draw your retired pay. Again, we've had problems with this. We've gotten the message out, but if you could just tell everybody, because maybe someday it will change, but until then, if you're a gray area retiree, you will not get regular reserve or regular retired until you're 60. Now, you still, as gray area retiree, are authorized TRR, that's TRICARE Reserve Retired, which is expensive, but if you're getting your retired pay, well, maybe you have a little extra money to pay for it. And that will do it for my slides. I'm going to turn it back to Sarah and let her go from here to start talking about the next slide. Thank you.
Thank you, Bob. Now we'll move on to some more examples for our QLEs, beginning with becoming Medicare eligible at age 65. So the things to remember here is that upon turning 65, you're auto-enrolled in TRICARE for life. Also, you must enroll in and pay for Medicare Part B. You'll receive documentation to enroll in Medicare about 2 to 3 months out from the date of that 65-year-old date of birth. You can find more information about enrolling in Medicare at www.ssa.gov to learn more about that and to sign up. So when the sponsor turns 65 and there's still eligible family members that are in the family, they can either change their plan or they can keep the one that they have. If there's no other eligible family members that are in the plan, then they would go from a family plan to a single plan, and that's either with TRICARE Prime or TRICARE Select. Also, if you have a healthcare coverage through your employer, you can actually delay the enrollment in Medicare Part B, but you must have Part A and Part B to have TRICARE for life. So please remember that, because there's been some members who don't really understand the transition to TRICARE for life, and they'll receive the documentation from the Social Security Administration, and they will not sign up. They don't want to. Well, what happens is that if you lose the Medicare, you don't sign up for it, you also lose your eligibility to TRICARE. So please remember that. You have to sign up for and you have to pay for Medicare Part B. You will get Part A as part of it. And you can find more information on this at tricare.mil/Medicare and tricare.mil/TFL. Remember that 90-day time frame. Separating from active duty. When a member separates from active duty, depending on the status of that member, you may qualify for TAMP, which is Transitional Assistance Management Program, or CHCBP, Continued Healthcare Benefit Program. If you're eligible for TAMP, you're going to automatically be enrolled into TRICARE Select. It pays like TRICARE Select. Again, remember, we continue to reiterate the 90-day time frame. That's the time frame, that you have to contact, enroll, contact DEERS, make any updates to them, contact the TRICARE contractor, and make any updates with them as well. If you're not eligible for TAMP, then you have 60 days then to enroll in the CHCBP. What's really important is like, some QLEs like separating and deactivating or marriage, you can also lose your eligibility, and you may be eligible for TAMP or the CHCBP. Just remember to contact DEERS first of all, because they the eligibility will be in your DEERS record. That's the thing, because as we have said before, it's the service that determines TRICARE eligibility. And it's the contractor then who manages the TRICARE enrollment. So to learn more about that, tricare.mil/separating. So how do you change your plan outside of a QLE? TRICARE open season. So for this year, TRICARE open season runs from November the 13th through December the 12th. And any changes that you make during that time will become effective January 1 of 2024. So make sure to check DEERS before open season starts, to ensure that everything in your DEERS record is correct and is up to date. Open enrollment season does not apply to active duty service members, to TRICARE for Life, or the TRICARE premium-based plans. And the plans that, that don't require a QLE are the TRICARE Reserve Select, the TRICARE Retired Reserve, and the TRICARE Young Adult. It's not affected by the QLE or open season. Voluntary dental and vision coverage. So depending on the sponsor status, the beneficiary's category, you can be eligible to purchase dental and vision coverage. That's through the TRICARE dental program and also through FedVip. So you have to actually go onto the website, and you have to go through, it's a little question and answers that you have to go through to see if you actually qualify for the FedVip program. And depending on the selections that you make, it'll come up with the results to say that you are or are not eligible. If you are, then you can purchase at that time. And you can find more information on tricare.mil/TDP for a TRICARE dental plan. And on FedVips, you would have to go to benefeds.com. Now, for this year, the open season for Benefeds is going to be from November the 13th through December the 11th. So make sure that if it's a FedVip QLE, make sure you contact them through that open enrollment season that they have there, right? And also contact the regional contractor, which is Health Net Federal Services for the West region, Humana for the East region, if you're going to change your plan. If not, there's nothing that you need to do. Make sure that your payment information is up to date. One issue that a lot of members experience is that if you have your payments for your premiums coming off of a debit card, please pay attention to the expiration date, because when the expiration date comes up, the contractor is going to get a little notice that, that expiration is coming up, and please provide us, a new payment information. So please pay attention to that, because sometimes members, their debit cards will be compromised. They have to get a new debit card. And they forget, to call in and update that information with the contractor, because, it's been a long time. It was automatically coming out. Sometimes it's a stressful situation, when your debit cards are compromised and you have to change and get a new one. So just remember, if there's any changes, you have to contact DEERS, right? Any changes in status, and then in enrollment, you have to contact the TRICARE contractor. So before we move on to our questions, we want to take a moment to highlight some helpful resources. As a reminder, you can find these resources and a copy of the slide deck that you received. In addition to the websites we've mentioned during our presentation, there's also TRICARE handbooks, there's procedures, brochures, and fact sheets. And it's a great way to learn more about your health plan options and about QLEs as well. So if you're planning to retire and you'll become eligible for Medicare soon, be sure to check out the materials about these topics. And you can also download them as well from tricare.mil/publications. Okay, the TRICARE contractors. As we mentioned throughout our presentation today, you'll need to call your TRICARE regional contractor to make any updates after a QLE. And as you can see here, for the East region, it's Humana. For the West region, is Health Net Federal Services. But then there's also, the others, USFHP, if you qualify, if you live in those areas. There's TRICARE Overseas, TRICARE for Life, and then the TRICARE Dental Program. And you can find more information on these at tricare.mil/partners. Lastly, we want to highlight a couple of new resources and ways to stay informed about TRICARE. The tricare.mil website, it has a new section that's called Getting Care. This is a one-stop shop for information about how you can get care through your health plan and how to find providers. And there's much more information there as well. And you can find this information about getting care at tricare.mil/getting care. And now we will move into our question and answer series.
First question. My husband and I are going through a divorce process right now, and he is my sponsor. What happens to my TRICARE eligibility once we get the divorce decree?
Once you get the divorce decree, the sponsor should go to the nearest Rapid ID card office with a copy of that divorce decree. The divorce is final at 12:01 on the day that the judge has signed it. And that spouse can contact DEERS actually for any eligibility that he or she might be eligible for following that divorce. The children, any children from that marriage will remain enrolled in TRICARE as long as they have eligibility. And you have to do that within that 90-day time frame. Please remember that.
Thank you. I'm pregnant and I wish to switch from TRICARE Prime to TRICARE Select. Is being pregnant a QLE?
No, being pregnant is not a QLE. When you have the child, that's your QLE.
I'm planning to get married and move to a new state soon. If I have 2 QLEs, which one can I use to change my plan?
Okay, sir, I can take this one. If you have 2 QLEs, for example, if you have a child in January and then you move in February, well, if you use the QLE for the child in February and you do it within the time frame, well, then if you have another QLE after that, you can use a new QLE for something else. But if they overlap, if you choose the second one first, then the first one becomes void. So you sometimes they do overlap. If you use the first one, you can use the second one. But if you use the second one and you haven't used the first one's void.
Okay. I'm currently in process of getting married. She is not a U.S. citizen. What am I required to do with paperwork?
This is very simple. All eligibility is handled through DMDC/DEERS. What they need to do is contact their nearest DEERS representative and talk to them about what kind of paperwork and the process it will take to get them eligible. Like I said before, DEERS is they report eligibility. And what TRICARE does is we give health care to anyone who shows up as eligible. But to get to that point, you have to talk to DEERS.
Thanks, Bob. I know that heading off to college is a QLE, but how should parents handle their kids' addresses in DEERS? Is it better to keep the parent's address in there? Otherwise, doesn't TRICARE EOBs go to the child?
That's kind of a twofold question. So in order for it to qualify for a QLE for that child, the address of that child has to change. Because sometimes parents, keep the child's address the same and not change it. So that would be the caveat for qualifying for the QLE.
The second part of that one was, is it better to keep the parent's address in there? Otherwise, the TRICARE EOBs will go directly to the child.
The EOBs go to the sponsor on record. So like I said, if you change the child's address when they go off to college, that's a QLE. It qualifies as a QLE. And anyone else in the family, that's eligible can also change their plans if they'd like to.
This is Calvin Keller with DHA Communications Division. I just want to add to that. If you change the address of that child is now considered an adult at 17 or 18 years of age, so that EOB is going to go to that child. It will not go to the sponsor's residence. In addition, you would need to really think about and look at how your child gets health care when they leave. If they are moving to a new region, then a lot of times that child's primary care doctor will not want to write referrals for a child that they are not seeing. And so you need to really think about this, look at the options of where that child is going to school at. Is that child going to be going to school in a prime service area that they may be able to enroll there and get a primary care manager? You need to consider all of that with moving.
Thank you, Calvin. One more question on addresses and college students. Do I need to change my son's address when he returns home during the college summer break, and again after he returns for the fall semester?
No, he does not have to change the address when he's on summer break, he or she, or even when they go back, so no.
Thank you, Sarah.
Mhm.
Is retiring from your civilian job where you lose your health care coverage and need to apply for TRICARE a QLE?
Take that one. It absolutely is a QLE. Any loss of outside health insurance is a QLE. So great question. If you lose your health care because you're changing jobs, retiring, whatever, you're losing your civilian health care, you can always use that as a QLE. You know, you can have both as well. So one will go from primary to secondary. But again, yes, it is absolutely a QLE. Next question.
Okay. Does moving QLE apply to retirees using TRICARE?
Yes, it does. Moving and changing the address, changing the zip code from one region to another is a QLE, yes. It must be reported, one, to DEERS, and also has to be reported to the regional contractor as well, Health Net Federal Services for the West and Humana for the East.
Thanks, Sarah.
Welcome.
Under the QLE, gaining or losing other health insurance, does that include losing vision and dental insurance?
Losing dental and vision, when it comes to being a retiree, you'd have to actually contact the people at Benefits. I mean, we saw that link, benefits.com, where you can go through the question and answer series there, and it will let you know if you're eligible for it. But that will come out through Benefits for FedVid. That's federal vision and dental coverage.
Can I still make changes to DEERS if I miss the 90-day window?
DEERS will make changes anytime you bring the change in. But what happens is that, if you have a child and you wait 8 months to enroll them in DEERS, DEERS will enroll them on the spot. Whenever you bring the paperwork in, they will enroll them on the spot. However, to enroll them in healthcare, it has to be within the 90 days of that QLE.
If retiring on 1 October 23, can I enroll in TRICARE Prime before 1 October 23 so that there is no break in coverage?
That's going to depend on the sponsor's status. So when you say retiring, is it retiring from active duty? Is it Guard or Reserve? So there's different applications dependent upon that sponsor's status. So if it's active duty, if you're retiring from active duty, and of course there's a lot of paperwork that you have to go through through your personnel office when retiring from active duty. And once it reports in DEERS that you're retired and you're eligible, you can then DEERS, your address is updated, then you can contact the contractor and enroll. If it's a Guard or Reserve member that's retiring, the key points are going to be at age 60. It's 60 years old, right, for the retiree. However, the TRICARE eligibility doesn't come at and if you're even receiving the retired, eligible for retired pay on the reserve, but you're not eligible for the TRICARE to enroll in it until age 60, even if, you're receiving retired pay at 55.
Thank you, Sarah. Another question. I retired from the Navy over 25 years ago. I'm now retiring from my civilian job. TRICARE was my secondary insurance. Is this a QLE, and do I need to notify TRICARE?
As I said before, if you're losing your outside healthcare, your primary healthcare insurance, that is a QLE. And even if TRICARE was your secondary, well, that will now become your primary. And because you have a QLE, if you want to switch your plan, you can. If you want to keep it the same, you may as well. But absolutely, it's still a QLE.
I'm turning 65 in March 2024. If I have to use Medicare, what happens to my family? Do I pay fees to enroll in Medicare and also fees for my family in TRICARE Prime?
The answer is yes. As Sarah had mentioned, to have Medicare, you have to pay Part B for yourself. If you're the one going on to Medicare, you have to pay your Part B plan fees. And if your family is enrolled in TRICARE, you will also have to pay their fees as well, or TRICARE fees.
I'm in the early stages of divorce. How do I make sure that I get what I'm entitled to? We were married for 35 years.
It all depends. There are, and again, this is in TRICARE.mil, you can look it up. There's something out there called the 2020 rule and 2015 rule. Rather than spending a lot of time on it, I'll just tell you that if you've been married long enough and you've been a dependent long enough, you can retain TRICARE benefits under your own Social Security number. But if you don't qualify for it, even if it says in the divorce decree that your spouse has to provide health care, you lose your TRICARE privileges if you do not qualify for that, and then your spouse is required to pay for your health care however they want to do it. But you lose TRICARE unless you qualify. Now, if you've been married 35 years, or chances are you do, because it's a 20-year rule. So again, contact your nearest DEERS office, and they can go over they explain it better. It's also on TRICARE.mil. It also outlines that program as well.
If you move to a location outside of Prime service area, can you keep Prime if you sign a drive time waiver?
Generally, yes. As long as you sign the drive time waiver, there are limitations on how far they will let you go. But if they give you a drive time waiver and it is accepted by the contractor, then yes, you can keep Prime. However, just know that if you get a referral and it's to somebody relatively close by, the military treatment facility always reserves the right to do what's called a ROFR, right of first refusal, and they can pull you back to the military treatment facility for that specialty care. Just keep that in mind.
Okay. Should I ensure that we're married prior to my enrollment in Medicare and TRICARE for life, or can we wait until after my birth month to enroll my new spouse in TRICARE Prime?
When it comes to a new marriage, the QLE begins on the date of the marriage. And so that's when, within that 90-day time frame, is when you would contact DEERS, right, to put that new spouse on your DEERS record. And then you would have to contact the regional contractor, HealthNet or Humana, to enroll your spouse in a new plan. You can't enroll or put anyone in your DEERS record without an affiliation. It means that, if it's not your child or adopted child, and if you have not married yet, they won't put that person in DEERS, and there will be no eligibility.
As a retiree, we have 12 months to enroll, but are we covered during that 12 months?
Now, it depends. I mean, the providers are going to bill you, and it's up to them on whether or not they're going to accept the fact that you tell them, oh, I've got TRICARE coming. I would advise against seeking heavy-duty care if you have not gotten your eligibility yet as a retiree. However, if you absolutely have to get care in that time frame, and then you do get your eligibility, they can pay your backdated claims. They can. However, I would just advise not to just go as if you're enrolled. Number one, the providers are going to tell you have no health insurance. And if you tell them that you could do self-pay if you want, knowing that you'll get it. But there are situations that happen that, the simple answer is you are not covered, but you will be covered retroactively. So take it from there.
I'm retired military and divorced. I have TRICARE Prime. If I remarry and update DEERS, can I enroll my new spouse in TRICARE? Can the new spouse enroll in Select while I stay in Prime?
Absolutely. Yes. You can enroll a new spouse. The spouse different family members can have different plans depending on their situation and what they desire. You'll have to pay two different enrollment fees for them. You'll have to pay for Prime and Select. But yes, absolutely.
And this is the last question we're going to have time for today. If we're PCSing, if my spouse moves first and we move later, what date is used for the 90 days?
If you are PCSing, then I'm assuming that that's somebody who's active duty. Active duty doesn't have QLEs. Active duty is active duty. You will have Prime. You will have Prime until you retire. So your spouse gets the QLE for the move. And then now if different family members move later, well, different family members are, if the spouse moves first and the children move at different times, each child gets their own QLE. If you go into DEERS that day and say, okay, look, this child moved this day, this child moved that day, my spouse has moved. If your spouse moves and records that as a QLE, then that's a QLE. But for active duty service members, you don't get QLEs, and it doesn't count. But you do, as a service member, you do have to report within a certain amount of time. Otherwise, your claims will get denied if you go out, if you end up getting referred outside.
I just want to ask Sarah and Bob if you all have any final or closing thoughts for our audience today.
Absolutely. Just want to reiterate some of the key points. One, it's a two-step process when it comes to qualifying life events and updating information, and also changing your plans. You have to contact DMDC to make sure that those changes and updates go into your DEERS record. You also then have to contact the TRICARE regional contractor, that's Health Net Federal Services for the West region or Humana for the East region. Another key point is 90-day window. Within the 90-day window is that QLE, with the exception of overseas. TRICARE.mil has a wealth of information on all of these topics that we've discussed today. Another one is that eligibility is determined by the sponsor's service, Army, Navy, Air Force, Marine, Guard, or Reserve. And then enrollment is taken care of by the regional contractor. Bob?
Thank you, Sarah. She said about everything I wanted to say as well. And I'll just reiterate, absolutely, DMDC will report eligibility. TRICARE will just give health care to whoever shows up in DEERS as being eligible. So if you have questions about how does this person become eligible, talk to DEERS. And again, always, anytime you make any changes in DEERS on BWE, Milk Connect, whatever, you're changing this, changing that, always, if you think it's going to affect healthcare, call the contractor and follow up all the time. You have a new spouse, new dependent, anything, call the contractor. Thank you very much for listening.
And I just want to thank Bob and Sarah and their team for sharing their invaluable experience and expertise. I'd also like to thank all of you, our attendees, for participating in today's webinar. If we didn't answer your question today, please refer to the contact information in your copy of the webinar slide deck. And also, you can find many answers to questions about TRICARE on the TRICARE website at tricare.mil. This concludes today's webinar on moving, marriage, and more, what TRICARE QLEs mean for you. Thank you.